Magandang hapon po sa ating lahat. Isang malusog at mapagpalang hapon po sa lahat ng nakasubaybay ngayon sa ating Kapihan with Media via DOH Facebook at YouTube channel, pages sa angmang bahagi ng ating bansa. Higit na masarap ang kape sa hapon kung may kwentuhan at kaalaman. Ako po si Muhammad Salishik, ang inyong katuwang sa mga usaping pangkalusugan mula sa Department of Health at makakasama nyo ngayong hapong ito para sa isang mahalagang usaping gigising sa ating isip at kamalayan. Pero bago tayo official na magsimula, let me read first our house rules. To ensure the smooth flow of this session, everyone is encouraged to: Number 1, use the naming convention below for Zoom usernames to ensure proper acknowledgement. Number 2, pay attention to the discussion of our health experts and resource person. Number 3, keep your microphones muted while speakers are discussing and presenting. Number 4, should you have questions, participants shall signify and send them in the Zoom chat box and wait for the host to acknowledge them. There shall be an open forum for the discussion. Submitted questions will be addressed first by our experts, followed by Zoom chat box questions. Every participant is advised to reserve questions. Only questions related to the topic discussed will be entertained. And lastly, please join the Kapihan until the last part of the session. Ngayong buwan ng Hunyo, ating iginugunita ang Men's Health Awareness Month at isa sa mga common na sakit na nakukuha ng kalakihan ay ang prostate cancer. Kaya naman ngayong buwan ng Hunyo, ating bibigyang pansin ang prostate cancer screening na may temang sama-samang labanan, tamang impormasyon ay kailangan. Lingid po sa kalaman nating lahat, after lung cancer, prostate cancer is the most common cancer for men. According to the National Kidney and Transplant Institute, prostate cancer develops in 19.3 out of every 100,000 Filipinos. At ang inisyatibong ito po sa pangunguna ng Department of Health ay naglalayong maitaas ang kamalayan ng publiko about prostate cancer in its early detection, and also to give the public necessary information on programs, understanding of the modern concept of treatment, prevention, and will go a long way in erasing the stigma on prostate cancer. Kaya naman po ang paggunita natin ng Men's Health Awareness Month ay nagsisilbing paalala sa bawat isa na we can take charge of our health and well-being. It is also to provide an opportunity for healthcare professionals, prostate cancer survivors, and patient advocates to come together to share their knowledge and experiences, raise awareness, and support those affected by prostate cancer. Kaya naman ngayong araw, ating aalamin ang mga paksa tungkol sa prostate cancer kasama ang ating espesyal na panauhin na handang magbahagi ng kanyang kaalaman tungkol rito. Hindi na po natin patagalin pa, narito na po ang ating panauhin na magbibigay ng kamalayan sa atin patungkol sa prostate cancer screening. Let us all welcome the President of the Philippine Society of Urologic Oncologists Incorporated, Dr. Rodolfo Aida Guzman. Magandang hapon po, Doc.
Hi, magandang hapon. Thank you for inviting me.
Thank
Good
you,
afternoon,
Doc.
everyone.
The virtual floor is now yours po, Doc.
All right, thank you. Let me bring up my slides. So when we talk about men's health, the most common cancer that will always come to mind will be prostate cancer. So that will be the theme of my talk today, about prostate cancer screening. Siyempre, when we talk about cancer, we not only talk about treatment, but I think the most important thing to talk about will be screening. Okay, so these are just some of my personal disclosures. So let me start by saying what every man should know about prostate cancer. So as mga lalaki, ano ba dapat nating alamin bago tayo matakot or kabahan tungkol sa prostate cancer? So first and foremost, this is one of the most curable malignancies when caught early. Like most cancers, pag maaga na diagnose at nagagamot, you can actually cure prostate cancer. It is the 5th most common overall malignancy worldwide, both male and for both male and females. And it's the 3rd most commonly diagnosed malignancy in men after lung and colon cancer. What we have to know today is screening is very important, but it's not meant for all men. So di dapat lahat ng lalaki at a certain age should get screened. And I'll discuss later on sino ba dapat nasa-screen for prostate cancer. And I think lastly, and I think most important for today is patients, even when diagnosed, often die with prostate cancer and not from prostate cancer. So, ang kadalasan is kahit na may prostate cancer isang lalaki, kung lalahon na siya, kasama niya ang prostate cancer, hindi dahil sa prostate cancer. So importante po yan. So looking at incidences, global incidence, prostate cancer, you can see it's in the world, across the world, it's the fourth most commonly diagnosed cancer worldwide. In over 100 countries, this is the most frequently diagnosed cancer. And a lot of it has to do with widespread PSA screening, which we'll get to a bit later. Looking at incidence in Asia, there has been a rising incidence in the past 5 years. So if you look at cancer incidence, Asia usually lags behind the world probably because of there are a lot more less developed countries in Asia, and we're not up to date with screening. And in general, the Asian population seems to be healthier in many regards when it comes to cancer. Okay, looking at mortality rates, this is the fifth leading cause of male-related cancer deaths, and Asia has the highest mortality rates. Now, whether or not this reflects the standard of care or the quality of healthcare is up for debate, but I think a lot of it has to do with detection, early detection versus late detection of prostate cancer. Now let's look at some facts here in the Philippines. Okay, you can see this occurs in about 10 per 100,000 men annually, since this is 2020 data. Okay, it's the third most common malignancy in men and fifth overall. And in terms of mortality here in the Philippines, it's the ninth most common cause of mortality. So medyo mababa po siya dito sa atin. Now looking at the mortality rate, it's highest in the Caribbean among the African men in the Caribbean islands, followed by Africa, which has the highest mortality rates, and some countries in South and Central Asia as well. Now here, if you narrow it down, we obviously would conclude that Metro Manila would have the highest incidence, and that would be true, the most populated region in the country. Now, the top three cities, Quezon City, Parañaque, and Manila, have the highest reported rates of cancer detection. Now, this is based on PhilHealth claims for the past 4 years. Now, sino ba dapat ang isa-screen? So, first of all, let's answer, sino ba ang usually nagpapatingin na may symptoms tungkol sa prostate? Okay, so ito lang. So, kadalasan or mostly, these are men who are elderly, so over 60 years of age by definition. Ito yung mga simptomas na nakikita namin sa clinic as urologists. So urinary symptoms, urinary retention, so hindi na uubos ang ihi pag nakaihi na. Pagkakala mo tapos ka na sa CR, babalik ka pa para ubusin mo lang yung laman ng pantog. Weak stream, so hindi ka na tumatama sa ihi mo sa likod na urinal or hindi na umaabot sa toilet bowl. So medyo bitin. And straining, so umiiri ka pa para umihi. Incontinence, so you have urinary leakages, so nauunahan ka kahit naiihi ka. You'll notice some leak in your pants before you get to the bathroom, which can be very embarrassing in a social situation. What else? Of course, you also have frequency, urgency, and nocturia. These are irritative symptoms. So lagi ka naiihi, feeling mo, ihi ka na kahit nakakaihi mo lang. And nocturia, this is the most bothersome and probably the most common reason why men come in. So sa gabi, ginigising ka na gising, kahit nakatulog ka ba 3 to 5 times, parang umihi lang. The question now is, should all these men be screened? So dapat ba i-screen lahat ng to? Hindi naman dapat. So the answer is really no. So let's look at the rationale for screening prostate cancer. Okay, on one side, the cons. Prostate cancer screening is non-specific. So we all know like the blood tests and whatever we do, like a digital rectal exam are prostate specific, but they are not cancer specific. So even if you have positive findings, that's not a diagnosis of prostate cancer. Remember, prostate cancer is indolent in nature. So tulad ng unang binanggit ko during my first slide is that many men will die with prostate cancer and not from prostate cancer. And when you detect it and treat it early, there's a high chance that you can be actually cured from prostate cancer. And of course, this is truer in the Western world, like in Europe and the United States and North America. The risk of overtreatment. So kahit na they have a lower stage of prostate cancer, nagpapa-opera pa or nagpapa-radiate pa na hindi kailangan. But this really is a case-to-case basis. I don't think it's true here in Asia and especially here in the Philippines. Now, on the other side, the flip side, ano yung advantages for screening? You have a very high incidence in men. Like I said, this is in the top 5 cancers in the Philippines and across the world. And we have to realize that this is curable. So that means you can cure it and forget about it when diagnosed early. And you want to prevent complications of disease progression. So kahit na sabihin mo, let's say, nahuli mo later on in the disease of prostate cancer, you will have complications of disease progression. Sana nahuli mo na mas aga habang hindi pa malala yung sakit, and you can prevent all of these complications and maintain a better quality of life early on. And remember, like all cancers, you have a favorable prognosis even when in advanced disease with prostate cancer, as long as you get treatment, which you cannot say for, let's say, lung and colon cancer, which are more common causes of death in men with cancer. This is still favorable. Let's say even if you get to metastatic disease with prostate cancer, as long as it's treated properly, you can live for many years. So the real aim of prostate cancer screening is to lower the number of men who die from the disease and also lower the number of men who develop the disease. So it's twofold or two-pronged. Now looking at guidelines, professional society guidelines, you have so many guidelines across the world. And here I'm proud to say we've recently released the Philippine Clinical Practice Guidelines for the diagnosis and management of prostate cancer. This was released 2 years ago. Okay, it's open to the public. You can get a copy. Okay, this is a collaboration between the Philippine Society of Medical Oncology and the Philippine Society of Urologic Oncology. Okay, to sum it all up, what are our recommendations for screening? We recommend against population-based screening, which means, ay ibig sabihin lang nito is, hindi lahat ng kalalakihan at let's say you get to age 50 should be screened. It should be targeted screening, and we'll get to that later. So we have to identify patients who are at risk for prostate cancer. Now, different ages, so across the world, some in North America and Europe, we recommend prostate cancer screening for men ages 45 and up. Here, it's about 50 and up. But the common consensus is you want to look at life expectancy, which I think is very important for all cancers. If you're expected to live 10 years or longer, that's where screening has a benefit. Below that, not so much. Okay, so another question now is, which set of guidelines do we follow? Okay, so there is no right or wrong answer here, but what we have to realize today is prostate cancer screening should be a shared decision. So hindi lang decision ko bilang doktor, pati kayo. May say kayo dyan as patients or as concerned citizens, whether you're the caregiver or the patient himself, shared decision natin yan. So you and I will decide whether or not screening will benefit you long term. Hindi yan one-way decision. Information should be freely shared between the physician and patient. So dapat yan pinaka-importante. Go consult a physician who is knowledgeable with prostate cancer management. So you should have a meaningful discussion about diagnosis all the way to management. Hindi pwede yung screening lang tapos ibibigay mo sa iba para sa management and so on and so forth. So okay, ito na. So identifying patients at risk. Sino ba at risk for prostate cancer? Okay, so family history is the strongest risk factor. So sino ba itong mga to? So this is a strictly male disease. We all know this is exclusively male prostate cancer. So immediate relatives. So this means father and a brother. Less so for the grandfather. If you have a father or a brother who has prostate cancer, especially if it's advanced prostate cancer, this will increase the risk of prostate cancer twofold. So double, 50% risk developing prostate cancer. And this is like an automatic go signal to have yourself screened. Okay, age, 60% of men diagnosed with prostate cancer are over 65 years of age. So this is usually seen in elderly males. Diet will always be a risk factor for almost all cancers. So obesity and diet in saturated fat. High in saturated fat will increase your risk of prostate cancer. So kayo mahilig kumain ng junk food, street food na mataba, and you're really at a BMI or yung body mass index mo sobrang taas, alam niyo na, magpatingin na rin kayo if you have symptoms. Okay, race, okay, this is not so important for us, but if you have, let's say, relatives or friends who are of African descent, they are at a 60% higher risk to develop prostate cancer than the regular population. So again, for today, I think this is the most important question we need to answer. Who should be screened? For us here in the Philippines, if you're at a risk for developing prostate cancer, men over 50. So you have to be at least 50 years of age before we even talk about screening, okay? It's rare in men under 50 years of age, maybe 1 to 3% will have prostate cancer. So it doesn't make sense to screen men below 50 unless you have a very, very strong family history. Family history, of course, is the strongest risk factor. First-degree relatives, father or brother, diagnosed with prostate cancer. Less common is if your mother or let's say your sister had breast or ovarian cancer, then you could have a genetic mutation which may lead to prostate cancer, but it's not as strong as family history. Now, here are the most common things we see. Men with symptoms. hematuria, hematospermia. So blood in the urine, or yung may dugo dun sa ejaculate, sa semilya nyo, yun. Okay, those are symptoms of prostate enlargement. It doesn't always mean that you have prostate cancer. Painful ejaculation, hypogastric pain, bone pain, and other symptoms related to the urinary tract, frequency, nocturia, yung madalas na gusto nyo umihi, yung sa gabi ginigising pa kayo para umihi, mahina, daloy, maputol-putol ang ihi nyo, hindi nauubos ang ihi or tsaka incontinence na tumutulong mag-isa ang ihi nyo. These are symptoms that would prompt you to see a urologist, but not necessarily be screened for prostate cancer. It's usually a combination of these factors. And before you have a meaningful discussion with your physician on whether or not you should be screened. So talking about screening, ano yung ginagamit natin? What are our screening tools? Dalawa lang po yun eh. Digital rectal examination and PSA or prostate-specific antigen, which is a blood test. Now, of course, I want to dispel any myths here. Hindi ganun kasakit ang DRE. Okay, it's just a visual representation, but it can be uncomfortable. But remember, this is very, very easy to do in the clinic. Okay, we all do this. It's a very effective screening tool. PSA is a blood test. Okay, remember, PSA is prostate specific. It's not cancer specific. And when I say that, this is what I mean. Abnormal findings in one or both. So let's say, kunwari, malaki ang prostate sa DRE or digital rectal examination, or may nakakapang bukol doon sa DRE, positive finding na po yun. Combined with PSA, let's say mataas ang PSA nyo over 4 nanograms per ml, or let's say one or both are positive or both are positive, hindi pa rin yan diagnosis ng prostate cancer. In fact, if you look at statistics, only 20% of men with abnormal results will actually have prostate cancer. So how do you diagnose it? So you have to first risk assess your patient. Low risk, ito, walang family history, low PSA. Okay. Ito yung mga high risk ang dapat mo iniisipan na kung kailangan i-screen for prostate cancer. Now, for low risk individuals, if you have to screen them, okay, you do this annually, PSA and DRE annually. Now, kung high risk, annually, ganun din. And here's what you have to diagnose. Once you have a positive screening, let's say, then you have to talk about diagnosis. Kailangan natin malaman, kasi screening lang yun eh. So we have to establish the diagnosis. Meron ba o walang prostate cancer? And here is the best way. So ito, like the picture shows, this is a transrectal ultrasound-guided biopsy. Ito yung gold standard across the world. This can come with or without MRI guidance, okay? Less common is pag na-operahan lang for prostate enlargement, parang TURP or transurethral resection, or tinatawag na lay terms as laser. Pwede po yan. You can diagnose prostate cancer for that, but that's more of an incidental finding. Ang talagang the best method to diagnose prostate cancer, the best treatment or modality to diagnose prostate cancer is a prostate biopsy. Okay, that's all you need. So again, that's another question now. Who should be biopsied? So high-risk men. Now let's say you have a PSA increase. Let's say you PSA mo year 1, you don't need to be screened. But let's say it increases by 25% to year 2, or by 0.75 nanograms per ml in 1 year. You should talk about at least discuss a biopsy. A palpable nodule of DRE with elevated PSA. So ito, positive findings for both. It doesn't mean you have prostate cancer, but you should have at least a discussion of whether or not you benefit from a biopsy. Again, I'll keep on coming back to this. Men with a strong family history of prostate cancer, a biopsy should always be discussed here to make sure that you can rule out prostate cancer definitively. And here's what is new. Okay, ito yung medyo mas maganda na ngayon. You don't have to go straight to a biopsy if you have positive findings on your screening. You can do what you call an MRI first, a multiparametric MRI of the prostate. Ito po yung mas bago. Ito mas specific for prostate cancer. You can see may lesions. Ito yung Pyrods 1 to 5. Kung may kang Pyrods 4 or 5 lesions doon sa MRI nyo, doon pa lang tayo pwede mag-biopsy. And you can use your MRI to guide you. So that's an additional step nowadays. Dati po kasi, what we do is with positive findings on your screening, diretso na kami na biopsy. Now, you can take another step. Kung wala kayong suspicious lesions, or let's say yung lesions mo Pyrods 1 hanggang 3 lang, pwede natin pa obserbahan yan. Hindi man kailangan i-biopsy kagad. Okay? And the nice thing about the MRI is it makes your biopsies more specific and more accurate. So you can do an MRI fusion biopsy like you see here. You get more accurate biopsy findings. Now looking at survival. So why do we say prostate cancer is indolent? 5-year relative survival regardless of stage, 97.1%. Now for localized disease, let's say it's your cancer is confined to the prostate, walang kalat sa labas, it's 100%. Kahit na kumalat sa kulane, dyan sa pelvis yun, so kulane malapit sa prostata, it's still 100%. Bumababa lang yan, it only decreases to 34% when you have distant metastases. The most common site of metastasis or spread outside the prostate is the bones, any bone in the body. Diyan bumababa na medyo to 34%. Now, kung hindi mo alam stage mo, let's say mataas ang PSA, BRE mo, positive, ayaw mo magpa-biopsy, pero may prostate cancer ka, your survival is still expected to be over 90%. Okay. Now looking at it long term, remember 5 years lang yun. Now long term, 10 years, 15 years. You can see 10 years, it's even higher. For some reason, it's 98%. 15-year relative survival goes down a little bit to 95%. So if you think about it, very few cancers, or if any, would be able to match these numbers in terms of survival. So the impact of screening is you want to keep this at these numbers for localized and regional metastasis. You want to keep them at 100%. Of course, when you get patients with distant metastasis, which you will always do, we want to hopefully increase this number from 34% maybe to 40 or 50%, but that really depends on the treatment the patient gets and the access or the accessibility to that treatment. Okay, here's where you want to keep it, 100%, okay, for localized and locally advanced disease. So for my take-home messages, so again, balikan natin yung unang message ko dyan, okay? So screening for prostate cancer should be targeted for individuals at risk. So yan, so madaling salita, hindi dapat lahat ng lalaki na nasa-screen for prostate cancer, mag-identify muna tayo ng risk factors kung meron kayo o wala, bago tayo mag-discuss kung kailangan i-screen. Kung meron kayong positive or suspicious findings sa screening, pag-usapan muna kung kailangan i-biopsy o hindi. Okay? The abnormal findings on screening are not indicative of prostate cancer until biopsy proven. So, balikan natin din ulit yung sinabi ko kanina. Ang diagnosis ng prostate cancer nakikita lang sa prostate biopsy, hindi po sa screening. Okay? Now, here is what is most important. Prostate cancer has a favorable prognosis even in advanced disease. And many men will live with prostate cancer and it will eventually pass from other causes. So, kahit na meron kayong diagnosis ng prostate cancer, hindi po yun ang katapusan. Kahit advanced disease pa yan, mabubuhay kayo na matagal pa basta nagamot kayo ng tama. Okay? Malamang kung mamamatay kayo dahil sa ibang sakit, hindi lang sa prostate cancer. I think this is my last slide. Thank you very much.
Thank you so much po, Doc, for sharing your knowledge and expertise at sa pagbibigay po ng tamang impormasyon no, tungkol sa prostate cancer screening. Dahil mahalagang malaman at magkaroon ng kaalaman ang publiko tungkol rito. So after that enlightening presentation on prostate cancer screening, tutungo na po tayo sa Q&A portion. These questions were submitted in advance to our media partners. If you have further questions, kindly send them in the Zoom chat box below. We will try to accommodate them as much as we can. Ready na po kayo sa questions, Doc?
Okay, go ahead. Anytime.
Yes, po. First question po, Doc. How has prostate cancer awareness impacted public knowledge and attitudes towards prostate cancer since its inception? Meron po bang mga datos na bumababa ang cases because of the increased awareness ng publiko?
Okay, two things, good and bad. Okay, first is, yeah, we've seen an increase in the numbers. So dumadami na yung nagpapatingin sa amin na may symptoms of prostate enlargement. So doon nag-uumpisa po lahat yun eh. So kung nahihirapan umihi or it's usually urinary symptoms, magpapatingin na lahat yan. Or what's becoming more common nowadays is nakikita sa ultrasound, yung mga incidental findings ng enlarged prostate. So madalas namin nakikita, they want to be screened. Unfortunately, we have to turn some of them down in terms of screening because they are not qualified for screening yet. It doesn't mean na hindi namin kayo gagamutin. Pero ibig sabihin lang yun, hindi pa kayo kailangan i-screen. Okay? So don't feel offended that way. And the bad thing is, there's a misperception that nobody dies from prostate cancer. So nakikita din namin sa mga pasyente, ay prostate cancer, wala namamatay doon. Hayaan na lang natin, wag na ako magpa-opera or magpa-radiate or magpagamot. Well, that is a myth. So any cancer, kahit gaano ka, let's say, indolent yan, if you don't receive any treatment, it will progress and it will metastasize. There's where the mortality rates come in. Doon namamatay yung mga pasyente pagpabaya. So if you do have a diagnosis of prostate cancer, as unfortunate as that may sound, if you get proper treatment, you can be expected to either be cured or at least live a very good quality of life, lead a very good quality of life for a very long time with proper treatment.
Thank you so much po, Doc. Second question po, Doc. At what age po dapat nagsisimula ang mga kalalakihan for screenings? Pero nabanggit niyo po kanina to sa presentation niyo na kanina, pero baka po gusto niyo pong...
Yeah, that's a very good question. So a lot of men will come in of any age, but the earliest age we recommend for prostate cancer screening alone is about 50. Let's say, but if you have symptoms pertaining to your urinary tract or you have incidental findings of prostate enlargement on any ultrasound, you can come in and you can have a consultation. That's not a problem. So we can treat you for your symptoms, or if you have any problems pertaining to your prostate. If you need to be screened, we'll talk about it first. Yun ang importante ngayon. It's a sharing of knowledge. So you have to empower also the patients and the general public regarding their disease. The long gone are the days where yung doctor lang nasusunod, yun ang doctor lang ang Diyos. So it's very important for you as patients and for the public to be informed of what is prostate cancer, what is prostate health. So when you take your journey throughout treatment, if you do have prostate cancer, naiintindihan nyo every step kung anong ginagawa sa inyo.
Thank you so much po, Doc. Next question po. What are the most common treatments for prostate cancer and how do they vary depending on the stage of the disease?
Well, mahabang discussion yan. Okay, so it's like any cancer. You have the big three. Of course, you have surgery, you have radiation, and you have what they call systemic treatment. So systemic treatment is medical. It's usually medication that affects the whole body. So most common for prostate cancer is what we call hormonal therapy in layman's terms, or for us, we call it androgen deprivation therapy. So anti-testosterone treatment. So it really depends on your stage of disease. Kung localized prostate cancer, you can make do with surgery or radiation alone. When the more advanced gets, you have to combine surgery or radiation with systemic treatment. But the thing nowadays, you can see the trend for very early prostate cancer, for localized lang yan, it's low risk prostate cancer. What you call active surveillance, that just means you don't treat at all, you just watch the PS. Usually, it's like you're doing screening every year, PSA and DRE. And nowadays, you can incorporate your multiparametric MRI of the prostate and just watch it. Okay, now, syempre, pag niisip mo, walang active treatment. So, yung stress of knowing you're living with cancer. But the thing is, if you look at data, most of these men will just live with a prostate cancer. It will not spread beyond that. It's becoming a more popular trend nowadays. It's not for everyone, but that just shows how indolent prostate cancer can be. It's always an option out there. But like I said, prostate cancer is still, it's like many other cancers, it's being treated by the big three treatment modalities: surgery, radiation, and systemic therapy.
Thank you so much po, Doc. Next question po. What recent advancement have been made in the research and treatment of prostate cancer po?
Okay, so two things. So for very early prostate cancer, like I just mentioned earlier, it's about active surveillance. So they're able to expand it. So that active surveillance now, so the earliest stage of prostate cancer, for very low risk. Now expanded that to intermediate risk. So you can see that the trend is we're learning that prostate cancer isn't as lethal or it's very non-lethal compared to other cancers. So we can do active surveillance up to intermediate risk disease. And for the most advanced, so dun tayo sa other side of the spectrum, so metastatic disease, now you can see patients surviving longer. So kahit yung may metastatic disease, may kalat na sa labas ng prostate, with proper treatment. So usually ang gamutan lang po yan, or maybe in some cases in combination with radiation, you can see them survive for a very, very long time as well. So you can see an improvement in survival from both ends, okay? Without treatment here for active surveillance and just closely observing the patients, and with just medical treatment on the metastatic side, you can see very long survival rates. So
Thank you, Doc. Thank you po. Second to the last question, Doc. Ano po ang mga initiatives ang typically organized during Prostate Cancer Awareness Month po?
Okay, like for this month, this is June, it's Men's Health. So we have an annual PADRE or DRE program. So this is not for prostate cancer screening per se. It's for men's health. So patients who have, yung mga kalalaki and they want answers regarding whether or not they want to be screened or just want to have their prostates checked. This will be sometime in June. Third week of June after Father's Day. So let me just check the calendar here. It's on June 22, okay? And then, yeah, it's a nationwide activity. So that's an initiative of the Philippine Urological Association. Now, the real World Prostate Cancer Awareness Month will be in September. We'll have a formal prostate cancer screening activity. We'll be releasing a video leading up to the event. So yun na. So that's more specific. We want to be able to see the men who should be screened for prostate cancer. You may symptoms, you may family history. We want to narrow it down and have a discussion with them whether or not they should be screened and whether or not they have to take the next step in getting a prostate biopsy. Okay, but it's really the most important thing is an information campaign. So what is the prostate for? Ano yung mga symptoms of prostate enlargement? Lahat ba yan kailangan i-screen for prostate cancer? And finally, when you have to be screened for prostate cancer, ano yung options mo? Let's say, get a biopsy. If it turns out to be positive, ano ba treatment options are best for you?
Thank you, Doc. Last question po. What are some common misconceptions about prostate cancer that need to be addressed po?
Well, like let me just mention it. For the first and foremost, bad thing that came up from widespread information is nobody dies from prostate cancer. So for any cancer, you will die if you don't get treated. Unfortunately, that's the unfortunate truth. Now, of course, there are some, let's say ikaw yung isa sa mga swerte na you have very early prostate cancer, you choose not to be treated. Perhaps you won't, but you don't want to take that risk. So if you're diagnosed with cancer, you see your physician or have at least a meaningful discussion with your physician and at least have the knowledge about your disease and what are the best treatment options out there. Of course, whether or not you opt for those treatment options is entirely up to you. Importante lang malaman mo kung anong sakit ko. Another misconception is ito. So when you get screened, when you take the next step, kailangan ko ma-screen for prostate cancer, papa blood test, which is a PSA, and you get a DRE, digital rectal examination. Pag may nakapa kami doon or mataas ang PSA nyo, that's not a diagnosis of prostate cancer. I have to keep on coming back to this kasi ang dami natatakot ditong lalaki. You see that we have to biopsy you first before we can tell you whether or not you have prostate cancer. That's step one. Step two is if you have prostate cancer, we'll have to have another lengthier or mas mahabang diskusyon po yan kung ano yung best treatment option para sa iyo. So hindi yan pwedeng i-shotgun. So itong treatment option pwede yan sa lahat. Hindi na po ganyan ngayon. Your treatment now should be individualized. Ano ang treatment option na bagay sa iyo? That's what the nice thing about prostate cancer is you have so many different options which will suit your lifestyle and your, let's say, your functional status and your way of life. So we can tailor your treatment to what suits you best. And you'll have still the best outcome later on. Your survival data, which I showed you, which approximating 100%, will always be applied to you if you get proper treatment.
Maraming salamat po, Doc, for the very informative answers sa bawat tanong po. Tunay nga po na ang screening ay napakalaking bagay. Hindi lamang po sa sakit ng prostate cancer, maging pati na rin po sa ibang sakit, no? Mahalagang magkaroon ang publiko ng sapat na kaalaman tungkol rito at palawakin ang kaalaman ng publiko tungkol sa prostate cancer. Kabilang ang mga sanhi, sintomas, at pamamaraan ng paggamot. Maraming salamat po, Doc. Also, a certificate of recognition is hereby awarded to Dr. Rodolfo I. de Guzman in recognition of his invaluable contributions as a resource speaker to the Department of Health Communication Office Kapihan session with media in celebration of the Men's Health Awareness Month. Signed by the Officer in Charge Division Chief of the Communication Office, Mr. Donato Dennis B. Magat. Doc, thank you so much po mula po sa Department of Health.
Thank you. Thank you very much. Good afternoon, everyone.
Lagi po natin tatandaan na it's not just about understanding the risk, it's about taking proactive steps to protect your health. Our speakers has given us the tools and knowledge, and now it's up to each one of us to be ambassadors and ambassadresses of awareness and prevention. Bilang tugon at suporta sa paggunita ng Prostate Cancer Awareness Month, sabay-sabay nating banggitin. Doc, sabayan niyo po ako. Sama-samang labanan, tamang impormasyon kailangan.
Tamang impormasyon kailangan. So that's very important. Okay.
Thank you so much, Doc.
Thank you.
Napakamabuluhan ng ating naging talakayan ngayong tanghali at panigurado na maraming natutunan ng ating mga kababayan ukol sa prostate cancer. Sa ating mga tagapakinig, lagi po nating alalahanin na naririto ang kagawaran ng kalusugan hindi lamang para masiguro ang healthy ang bawat Pilipino, kundi mabigyan din tayo ng sapat na kaalaman sa mga serbisyo at isyong pangkalusugan. Mula noon hanggang ngayon, ang Kagawaran ng Kalusugan ay nagpapasalamat sa aming mga media partners sa patuloy na pagiging katuwang sa pagpapalaganap ng tamang impormasyong pangkalusugan. Muli, ako po si Muhammad Salishik, ang inyong pagkalingang lingkod mula sa Kagawaran ng Kalusugan na sinisigurong hatid ay edukasyon at impormasyon sa kalusugan. Atin pong suportahan ang mga programang nagtataguyod ng kapakanan ng mga taong nakakaranas ng prostate cancer. Dahil sa bagong Pilipinas, bawat buhay ay mahalaga. Magkita-kita po tayong muli sa susunod na linggo sa Kapihan with Media. Maraming salamat po.